With RSV season here, many parents worry about how this may affect their little ones. In this video, we're going to break this down and look at this simply and clearly for you. So the first thing to say is that it is a very common virus that many children get, and with simple supportive care, most children are well within a couple of weeks. However, in this video, we're going to talk about some of the complications that may occur. So RSV tends to affect the upper lungs and upper airways, and in little children, so it tends to be under 2s, it can cause a condition called bronchiolitis. And in bronchiolitis, what we often find is that these younger children have this very classical wet, wheezy sounding cough, and in more serious illness with it, they can struggle to breathe with it, and it can impact their feeding as well. In older children, we sometimes see something called croup, which again is caused by inflammation around the upper airways and swelling around the vocal cords. So they get this real classical sounding barking cough. So it sounds like a dog barking, and it can be very scary for the parent to hear their child with this cough. However, it can be easily managed. I will go into more detail in these conditions in a future video because it's important to know what to look out for if your child is displaying these symptoms. However, most commonly with RSV, children have mild cold symptoms, so real typical runny nose, cough, mild fever, and probably a little bit lethargic with it. So as I mentioned before, most children recover at home without any need for doctor or hospital input. And as a parent, what you need to do is help give supportive treatment. So making sure they're well hydrated, getting enough rest, and possibly giving some Calpol or ibuprofen to help if they are struggling with any of their symptoms. So I'm going to do a quick rundown on what we would deem as red flag symptoms, so symptoms that something more serious could be going on. These include laboured breathing, and I've shown this in a previous video, so signs of respiratory distress. Sucking in at the belly or the ribs, tugging of the trachea as they're breathing can be a sign that your little one is putting more effort into their breathing. If their lips or fingertips or toes start looking blue, that can be a sign that they're not getting enough oxygen as well. If they seem overly lethargic, now it's normal when children have a virus that they're a bit more tired and want more sleep, but if they're floppy, not acting as you would have thought they should be, you need to get urgent help. With the littler ones as well, we look at how much they're managing to feed, so how much milk they're getting. If it's less than half the normal, we see this as a red flag, and we often get some further help at that point. So in summary, RSV is actually very common and normally can be managed at home. However, trust your instincts, and if you're worried, do contact a healthcare professional. If you have any questions, please do not hesitate to pop them in the comments because we're going to continue the theme talking about RSV over the next few weeks.